I says, no, no, no. I says, it wasn't luck. I says, I did my homework. I said, I went to 3 different seminars, and I said, I picked the best. I said, I picked the best surgeon there is for weight loss surgery, and I'll stand behind that 100%. There's no luck involved in it. It's called doing your homework. And you choose the best. When it comes to my health, I want the best. And if I got a sniffly cold and I go to a doctor and and maybe you don't have to have the best to, get an antibiotic for a sinus infection or something like that. Physician's assistant might be okay for that, but I don't want a physician's assistant to do my bypass surgery. I want the best, and I'm 100% sure that I got the best. I'm just blessed to live in the town where Dr. Rutledge practices, and I didn't have to travel a long way to do it. But I'll tell you, it's not a matter of luck. It's a matter of doing your homework and being able to pick the best. And I just never regretted it, not even for an instant. And I just can't encourage you people that haven't made a decision. I promise you, you'll never regret it.
Can you drink alcohol afterwards?
I don't know.
Yes.
I did before, so I wouldn't know why.
The answer is no.
Not at all.
No. Now, you can do anything you want after you leave here. Our advice is, though, that drinking alcohol after the surgery is not a good idea because it damages the lining of your stomach and can cause ulcers and it can damage your liver.
Okay, what about wine?
No, no wine either.
But here's the deal. Now, correct me if I'm wrong on this. When we undertook this, we sort of had an understanding that if you're going to do this, you're going to do it right. And there was to be no more carbonated beverages, no more coffee, and no more tea, and no more alcoholic beverages, and no aspirin, no Tylenol. Did I leave anything out?
Well, we like not to touch on those things right off because you kind of have everybody leaving the room when you bring those up.
No, but you know what? That's nothing. To me, it's not a problem. But I've lived by it. I've lived by it, and it hasn't been hard. It really hasn't.
What do you do for pain? I mean, if you have a headache or a backache.
I haven't had any.
You haven't had any pain
I
at
just
all?
really don't have. No, I haven't
What
had
do you
any.
do for pain?
Well, it's a great question, and let's touch on a couple of things. First of all, my favorite thing about when you and I see each other is I remember when you said to me, "Hi, I'm your patient, the former diabetic."
That's
Okay.
true.
A former diabetic. Now, this has sounded pretty good about our surgery tonight, right?
Mhm.
You think this is a free lunch? No, there's no free lunch. So for all these wonderful things, in other words, a cure of diabetes, a cure of sleep apnea, take off the breathing machine at night, a cure of high cholesterol, avoiding heart attacks, avoiding strokes, okay? When I talk to my patients, you know what they tell me? You can't even understand what it's like to be obese. Being obese in my life is so terrible, Dr. Rutledge. You can't even imagine it. And then, you know what I say? I say, I got the cure. Short operation, simple, easy to do. But I just don't want you to drink alcohol. And they go, oh, well, I can't do that. So one minute they tell me, obesity is terrible.
Yeah.
It's a disaster. It ruins my life. And then we say, well, don't take aspirin. I say, oh, I couldn't do that. One minute they say, I'll give my right arm, but I have to have Diet Coke. So what we tell you is there are some downsides, there are some trade-offs to any medical treatment. Our medical treatment is you can get an ulcer after the surgery. You can get gastritis and irritation of the lining of the stomach. That's our most common problem, and we don't want you to get that. So we ask you to avoid those things that are known to cause ulcers, like junk food, aspirin, alcohol, cigarettes, things like that. Now, if you get a stub toe, a headache, normally you go to the grocery store and you get a handful of Tylenol or a handful of aspirin. We say don't. Now that's a terrible trade-off. You lose the opportunity to have a handful of Tylenol or aspirin at your disposal, but those are only mild pain relievers. If you have major pain, you can take narcotics if you need it. And what we ask our patients, pre-op, they had access to Tylenol and aspirin like crazy. Mm-hmm. And we ask them, you compare your life pre-op, when you had all those drugs available to you, and post-op when we take it away, which life would you prefer?
I guarantee